Hi, I'm Whitney Morgan, Hashimoto's coach, gluten-free warrior, and creator of the Thyroid Reboot Method and the Gluten Gauntlet mini course. There is a lot of confusion out there about thyroid medication. What are your options? What are the differences between the different types of medication? And what will your doctor be willing to prescribe for you? Well, in today's video, I'm going to give you the quick rundown on what's up today in the thyroid hormone replacement world. But before we jump into it, go ahead and hit that subscribe button and the little bell next to it so you'll get notified every time I post a new video. I've worked with dozens of women with Hashimoto's and hypothyroidism, and almost every single client comes to me already taking some form of thyroid hormone replacement. And eventually, my clients want my advice about whether the thyroid medication they're taking is actually the best option for them. Now, let me just say right here that giving advice about prescription medication is way outside of my scope of practice. So I'm not doing that here, and I don't do that with my clients. My role is educational. I give my clients the benefit of my wisdom and my clinical experience so that they're able to have more productive conversations with their doctors about their hormone replacement strategy. So in today's video, I'm going to talk about the options that are out there for thyroid hormone replacement therapy. I'm also going to touch upon what's the difference between those options. And finally, what are some of the pros and cons that you might want to discuss with your doctor? There are three basic types of thyroid hormone replacement. The first is a synthetic prescription hormone. Now, the most common is Synthroid, and it's also known in its generic form as levothyroxine. Now, this is a T4 only medication, and synthetic T4 medications vary in their filler ingredients, or what are known as the inactive ingredients in the formulation. So I don't usually recommend that women switch back and forth between the different generic options of this medication. If you're fortunate enough to find a T4 only medication that works for you, you should stick with it. And by that, I mean, don't switch manufacturers, don't switch one generic form for another, because sometimes the different filler ingredients can impact your body differently. Now, pharmacists don't have to tell you when they switch out one generic for another. So one way to keep this from happening is to have your doctor write no substitutions on your prescription. That way, if the pharmacy is out of the generic brand that you use, they have to inform you before they switch it. Now, in my opinion, there are a couple of drawbacks to synthetic T4 only medication. The first is that some of the fillers used in certain formulations of these medications can interfere with absorption. In addition to that, they can also serve as triggers for a Hashimoto's flare, because some formulations actually contain gluten or corn, both of which are known triggers for Hashimoto's. And the second drawback is that T4 needs to be converted to T3 in order for you to feel better. So if something is interfering with your body's ability to convert T4 to T3, which is very common, your low thyroid symptoms are less likely to improve, even if your doctor increases your T4 dose. Fortunately, if you're having conversion issues, your doctor could also prescribe you a T3 only medication. Now, this is known as Cytomel or liothyronine in its generic form. Some women who don't get the results they want from T4 only medication start to feel much better when they add T3 medication to their daily regimen. Have you ever taken a T4 only medication? If so, let me know in the comments how you felt. Did you find that your low thyroid symptoms improved, or did you have to switch to something else? The second type of thyroid medication is what's called NDT, which stands for naturally desiccated thyroid. And there are two types of NDT products. The first is the prescription options like Armour, WP Thyroid, NatureThyroid, and NP Thyroid. All of these products are made from US FDA pig thyroid glands, and they contain both T4 and T3. Unfortunately, at the time of this recording, some of these products are tough to get. Both WP Thyroid and NatureThyroid have been recalled due to sub-potency issues. meaning that upon testing, many of the batches didn't meet the potency requirements that were listed on the product label. Because of the recalls, NP thyroid, though it's still available, is hard to come by due to shortages and back orders. And so Armour is really the only option that's readily available. Unfortunately, it's also the NDT product that has the most fillers, and it contains corn, and I consider it kind of the dirtiest prescription ND product out there. And in my experience, many women don't feel good on it, and that's why they end up switching to something like NP or WP or Nature-Throid. Generally speaking, the benefit of NDT products is that they contain both T4 and T3. They also contain small amounts of T1 and T2. Now, we don't really care so much about T1 and T2 in the thyroid world. Honestly, we don't know much about them, but some people think that they might have synergistic quality with T3 and T4. So it could be beneficial to take a product that contains naturally occurring amounts of T1 and T2. Another benefit of NDT products is that while excluding Armour, they tend to have fewer fillers and potential allergens than their synthetic prescription counterparts. There are some drawbacks to NDT products. The first is that some people have ethical objections to animal-derived hormone. The second is that in addition to containing naturally occurring amounts of T1, T2, T3, and T4, naturally desiccated products also contain TPO and thyroglobulin. And some experts in the field think that the TPO and the thyroglobulin in these products are enough to provoke Hashimoto flares for some women. Another drawback, in my opinion, is that even without the shortages or the recalls, women have a hard time getting their doctors to prescribe them anything other than Armour. So they wind up having to choose between a synthetic product with fillers and some potential allergens and a naturally desiccated product with fillers and potential allergens. So for some women, it's kind of a lose-lose situation. But remember, I said that there were two types of naturally desiccated thyroid products. The second is a non-prescription option. These NDT products are marketed more as thyroid support supplements. One of the obvious benefits here is that they're easier to obtain, you can order them online, and you don't need a prescription. They also tend to be much cleaner than their prescription counterparts. The ones that I'm familiar with in my practice, they're sourced from 100% grass-fed New Zealand cattle, and they have far fewer fillers or potential allergens. If you're interested in learning more about these non-prescription NDT options, the four manufacturers that I'm familiar with are Priority One, Natural Thyroid Solutions, Forefront Health, and Professional Health Products. And I'll drop the links to these products in the video notes. The main drawback of the non-prescription options is that the potency is not regulated. So there's no way to guarantee exactly how much T4 or how much T3 is in each and every batch. So even though you might take 150 milligrams of a non-prescription desiccated thyroid every morning, how much T4 and T3 that 150 milligram delivers might vary from one bottle to another. I want to make a quick side note here before I wrap up. There's another option that you can consider and talk to your doctor about when you're trying to decide on what thyroid medication is right for you. And that's getting a compounded product. Compounding pharmacies make customized prescription formulas on site. And the ratio of T4 to T3 can be customized to meet your specific needs. One of the benefits of compounded products is that they're usually free of fillers and potential allergens. And some compounding pharmacies offer immediate release and slow release options for thyroid medication. And the final bonus is that many compounding pharmacies offer both naturally desiccated and synthetic forms of a compounded thyroid product. So if your doctor is familiar with compounding pharmacies and is comfortable customizing a compounding product for you, that might be the way to go. The downside of compounded products is that they take a little time to prepare. So you might have to wait 2 or 3 days after ordering your refill to pick up your prescription. Not everyone will have the option of a compounded product because, compounding pharmacies aren't everywhere. And so finding one in your area could be difficult. Beyond that, finding a doctor who's really comfortable using compounding pharmacies can also be difficult. I know I've covered a lot of ground in this video, so just to recap, you have some options for thyroid medication. You have synthetic prescriptions like Synthroid, levothyroxine, which are T4 only. You also have synthetic T3 options like Cytomel and the generic versions of Cytomel. Then you have naturally desiccated products, both prescription and non-prescription. If your current thyroid medication isn't getting you the results that you want, my hope is that you can use the information in today's video so you can have a more productive conversation with your prescribing practitioner and hopefully get an option that works better for you. To learn more about my thyroid reboot method and how to kick those low thyroid symptoms to the curb and get the fierce, energetic body you deserve, schedule a free call with me today, and let's find out if my program is a good fit for you. I'll drop my scheduling link in the video notes. Now, if you're watching on Instagram, just head to my bio link. Thanks for watching. If you found this video helpful, you can let me know by liking it, subscribing to my channel, or sharing this video with a friend who has Hashimoto's or hypothyroidism. And as always, if you have questions, just drop them in the comments. I try my best to answer everyone. Thanks again. I'll see you next time. Bye.